Hi, I'm Dr. Lizzie Rowe. I'm a research associate in farm animal welfare at the University of Bristol, and I'm also the senior research officer at the Sustainable Food Trust. And I'm hugely passionate about giving the animals that we use for food a good life and a kind death, and farming them in a way that respects their lives and respects the planet. And one of the things that this coronavirus pandemic has really shone a light on is the need for animal welfare to be a priority in our food system, not just a luxury or something that would be nice to have in an ideal world. It's not entirely certain where the COVID-19 virus first emerged, but a likely theory is that it came from a market in China that sold live animals for slaughter and consumption. And the welfare conditions in these markets are usually very poor. There's a lot of suffering going on. The animals are kept in cramped, dirty conditions. They're often thirsty and injured and handled roughly, both at the markets and during transportation. And this distress that the animals are in can lead to suppression of their immune system. So this can unleash viruses that they may be harbouring. And this may explain the transmission of such a virus from wild animals to humans at one of these markets. But it's not just, this isn't just a problem at wildlife markets. Millions of animals farmed in factory farms are kept in conditions which result in distress. For example, due to confinement, lack of mental stimulation, poor handling and transportation. And this distress can also lead to the emergence of diseases that can infect humans. Because animals are cramped together in factory farms, which in itself is stressful for them, and because all the animals are bred to be genetically the same, diseases can spread like wildfire through these animals and over to humans. Also, the misuse and overuse of antibiotics in factory farms encourages the development of bacterial diseases that may be unable to be treated with antibiotics, which could be deadly for humans. So all these factors make factory farms the perfect cauldron for disease emergence. In contrast, farming systems that promote better welfare, higher welfare farming systems that don't rely on antibiotics, and these systems keep animals healthy because they look after the animals well and give them everything that they need, such as space, environmental enrichment, and the things they need to ensure the animals' well-being. And making sure that these animals have good welfare means that they are in good health, which is linked to our own health and our own well-being. So we must continue to push for better welfare for farmed animals, for their sake and for our own.